Sit to stand with the assistance of one carer. We prepare the patient and the chair as we did before. That is a good, stable, appropriate height chair. The patient shuffles forward in the chair with their feet in a stable position. Hands are on the arms of the chair and they lean forward. The carer's position is also important. The carer stands to the side and close to the patient, facing forwards, in a step stance posture or squatted position. The carer's outside foot is in front, which allows them to transfer their weight and use their strong leg muscles. Carer bends her knees and reaches across the patient's back with her inside arm towards the patient's far hip, allowing them to use their arm as a lever. The outside hand cups around the front of the patient's shoulder. A gentle forward and upward rocking movement can be used. Use the command ready, steady, stand, encouraging the patient to use their legs to push up into standing. As the patient stands, the carer steps forward to remain close. At this point, the carer can take the patient's hand. The hold is important and is referred to as a palm-to-palm hold. There should be no interlocking of thumbs, as this can be difficult to release from if the patient was to stumble or fall. Allow the patient to keep their hand at a comfortable level, around the height you might hold a walking stick at, using the palm-to-palm hold. When walking with the patient, stand to the side and a little bit behind. It is also helpful if the carer can match the footfall of the patient as they walk together. Patients often like to try to sit down before it is safe to do so. Always encourage them to avoid shortcuts and to step back until they feel the chair at the back of their legs. The carer turns round to face the back of the chair. They place their inside arm across the front of the patient, placing their hand on their opposite hip. Their outside hand is placed on the near shoulder blade. Ask the patient to place their hands on the arms of the chair and bend in the middle to sit down. Carer must also bend their knees as the patient lowers into the chair.